Hey, Mike, if I were to say bow tie, eyes, and enthusiasm, who would you think of?
David Williams.
Bingo. Let's get him in.
Excellent.
Hi, I'm Mike Brampton.
And my name is Julian Hoad.
Welcome to Veterinary Ramblings.
You know, I was thinking of you today because...
Oh, lovely. Thank you.
I often think you actually, but I was thinking you especially today because I was sitting in the dissection room at the Royal Veterinary College doing some interviewing, and that was the place I first met you.
Fantastic.
Which was, 34 years ago, I think.
Something like that, yeah.
Yeah. And so
you've not spoken since.
And I was just saying to Mike that actually we used to have breakfast in the canteen at the bottom and chat. But yeah, maybe in the dissection room as well. Yes.
yeah, when you waltzed in, you didn't waltz in, you walked in magnificently, as you do. And I thought, oh, what a nice bow tie. And that's what most people think when they see you. And then when they see you a second time, they think, what a nice guy wearing that bow tie. So, and I think I've told Mike this story before, but David actually taught me how to tie a bow tie.
Oh, really?
So, yeah. And it's a moment of pride every time you go to a dinner party.
I taught you nothing else in it, but maybe a bit of an eye as well as a bow tie.
Oh, yes, that's right. Ties and eyes.
Ties and eyes.
Ties and eyes.
But I understand, David, that you've been wearing a bow tie since you were 12.
No, 17.
Oh,
so,
17.
So my mum wanted me, teenage rebellion. My mum wanted me to be wearing a t-shirt and jeans like every other kid, to be like everybody else. But I wanted to be exactly unlike everybody else. So I always used to have my tie done right up to the top, even in the middle of summer. And then, so the first day of my gap year, that would be September, whatever it was, 1980 or something like that. I went and bought a bow tie from an outfitter's in Jermyn Street, just off Piccadilly, and I've never looked back.
I've heard it rumoured that no person has ever seen you wear the same bow tie twice.
Well, yes, I've only got 260, so lots of people will have seen me wear them several times, but I would never wear them within, a couple of months. So I have 3 little hangers, and they go from the front hanger to the back hanger. So there would be whatever 260 divided by 3 is between days between being seen with them. So yes, so I have, as you'll see on the Instagram. I mean, now we've got 2,600. I can't remember how many posts you've got on the Instagram, but we've got a fair number. If 1 in every 7 is a bow tie, so some of the bow ties are coming round again, clearly. So let me just have a look. So I've got 2,153 posts. So obviously within that 253 divided by 7, well, that's going to be about 30 times they will have seen those same the bow ties potentially. So yeah. So
yeah. So a few people have seen them twice, but not many.
Yes, not many, and never within the same month, few months.
Within a couple of months, yeah.
Yeah, exactly.
That was brilliant. So when you came to the RBC, I remember the first lecture you gave us. We were expecting a lecture on ophthalmology, but we got a lecture on MRI scans of the skull, if you remember.
Well, only the first 2 PowerPoint slides. I think they wouldn't have been PowerPoint slides. They would have been Kodachrome slides.
They were slides, yes, they were.
The first 2 Kodachrome slides. Oh, those are good old days, weren't they? The first 2 Kodachrome slides, as you say, were MRI. Well, actually, I think CT scans. So when they get you in there, they do a CT. So CT scans of my brain immediately. Well, a few hours after the little contretemps I had with a car on Clapham Common. So I was trying to lose. I really was quite chubby in those days. I was trying to lose weight. So I lived in Clapham, in Clapham South. I was working, obviously, doing my PhD at the Royal Veterinary College. So I just cycled from Clapham South to Camden every day. And the aim was to lose weight, and it worked perfectly because the one day when I didn't wear my helmet, a guy was coming along. I thought at 30 miles an hour, actually was coming out at 48 miles an hour. And so I bullseyed his windscreen and then bounced off factory onto some iron railings. and the iron mains, I ruptured my anterior mesenteric. Do you remember what organs does the anterior mesenteric artery supply?
Pretty much all of the tubular organs of the intestines.
Yes, and the liver and the spleen.
I was going to say it's the
as
Which
well.
spleen.
is
Yeah.
liver, spleen, and the right side
Pancreas.
pancreas.
Indeed, exactly. So well done. So with all that blood gushing out intra-abdominally, thankfully, very little gush out into my brain. But the trouble was as I bullseyed the windscreen, my skull stopped and the brain just kept on going. So you have lots of little, all your axons get pranged, and you get this thing called diffuse axonal injury. So that wasn't really nice. But the main thing was, of course, that I needed oxygen to all those parts. So what had happened was there was someone looking down. I mean, I do think there was someone looking down ethereally, but as well, there was someone looking down from his bedroom window. And as the accident happened, he picked up the phone and dialed 999. So the helicopter, very useful to be knocked over on Clapham Common. There was a great green space for the first year that HEMS, the helicopter emergency service, was actually working. So they landed and did a diagnostic peritoneal lavage, found that I had lots of blood in my abdomen, gave me fluids, and they in those days they didn't actually carry blood on the helicopter, but gave me fluids, and the most importantly, intubated me and gave me 100% oxygen, and that's why I'm here today. So then what I wanted to make sure in going back to the lecture, I wanted to make sure that everyone knew that they should be wearing their helmets every day. So that was the reason for showing you the interesting CTs. I also, to show you that neuroanatomy doesn't really work, and a large a bleed in my internal capsule. So Mike, do you remember what the internal capsule supplies?
No.
So all the pyramidal tracts down the other side of your body. So I should have been paralyzed, but I wasn't. So, and that's probably because at the time, I had 100% oxygen. So even though there was a sizable bleed in there, actually the axons were still going. So the axons, thankfully, are still going now. So
the mesenteric bleed meant that you didn't have an increased cranial pressure, and the intubated oxygen meant that even despite your reduced blood flow, what you had was super oxygenated.
Exactly. Super oxygenated. Exactly.
Do you still have your spleen?
No, yes, thankfully I do. Yes. Interesting, isn't it? So the spleen, of course, is really important immunologically. So lots of people who have their spleens, I was talking to a student only a couple of days ago, lots of people who have their spleens out are on continual antibiotics. But we don't do that with dogs. Lots of dogs have had their spleens out. And the other interesting thing is that all the immunology of your eye actually links in with your spleen. If your antigen presenting cells see something weird in your eye, they toddle off to your spleen, say hello to the lymphocytes there, and the spleen is a Th2 environment. It's telling the lymphocytes to produce antibodies rather than being cell killing. And so they toddle back to your eye and produce lots of antibodies there rather than a horrible inflammatory reaction. Sometimes, of course, it doesn't work, and we have uveitis, as we see quite often. But most of the time, if you've got a diabetic dog with a cataract, you'll see that the iris is really dark, and that shows a mild lens-induced uveitis. But actually, that's because there are lots of little lens proteins swirling around the front of your eye, and the eye is going, we should kill. But actually, the spleen is going, calm down. Let's just send some antibodies in there. So, I mean, that's a lovely. What I love about the eye is you can see what's going on, and you can see all the science happening in it. Sort of thing.
It's fantastic. Do dogs have that same antigen presenting?
The camerosplenic axis is seen in every mammal.
But we don't see an increase in uveitis in splenectomized dogs.
Or do we?
We just don't notice it.
Well, it'd be very interesting, wouldn't it? So let's have a look at. Actually, generally, what we don't see much wrong in a splenectomized dog, do we? So it'd be interesting to know what's going on in those animals. So it's been shown that if you've got a laboratory mouse and you take its spleen out, you do change what's going on. But it'd be really interesting to find out, say, diabetic dogs with their spleens
Really?
removed, have they got a different reaction to their intralenticular proteins? So
Yes, because thinking about it, I can't remember.
I'm just going to write that down as a student project, if you don't mind. Just a sec.
Or as a Pet Savers funded project.
You could do, yes, absolutely.
I can't remember splenectomizing a diabetic dog.
No, probably not. But you might find a dog that was splenectomized at some point in the past. It'd be very interesting, wouldn't it? Just to look at a whole load of splenectomized dogs and just look at their eyes and see if there's anything abnormal going on there. Yes.
It's the sort of thing that you could do a data search on.
Yes, you could. I mean, I always prefer things that are prospective, where I've actually got an idea, and then what the lovely thing. So in Cambridge, we in the final year, we were putting on 5 or 6 students in every year that are doing an eye project with me, and we start off in their late 4th year, so we've got 2 years to collect data, and that's why it's much nicer to do prospective study, because then you can get all the information you need for every case. Trying to do a retrospective study, there are so many animals that I noticed the same in people. I work with the ophthalmologists at our local hospital, and when they try to do a retrospective study, this is the NHS, but even so, they find that actually, if here's the 20 things that we need to know about this patient, and a very small number of patients, you know everything about that you need to for a retrospective study. So that's why I prefer to do prospective studies. But
they take longer in something like this, though, wouldn't they? Trying to get those cases.
Oh yeah, yes, they would. Yes, but some of us, I'm 61, so I've only got probably another 20 years to go before we start slowing down on that stuff. So there's still. I mean, what I love doing is I was lecturing in Gloucester in Quedgeley for BSADA a couple of days ago, and the number of potential projects that we came up with in just having that conversation. It was wonderful to do it with. So something like the group of vets that are there, if they all got out of their systems, we could do a humanized vet compass, where actually people look for data from their systems rather than the computer. So I prefer humans than computers. But it's just soon, of course, we won't know which is the human and which is an avatar with a computer behind it. So that'll be interesting, won't it?
Well, I'm sure I spoke to an avatar the other day, and there was some helpline that I phoned.
The vet students have to do abattoir practice, don't they? So they can just do avatar practice. It's only a change of one letter. So
it's a syntactical change, isn't it, rather than anything else?
Indeed, it is something.
This is killing
Mike
me.
and I was sharing a little laugh there at the thought that you ever slow down. It's not going to happen, David. Let's face it.
A great friend of mine, actually, the Dean of St. John's, when I was there, was at a wonderful celebration party for his friend who was 90. He's 88, I think, and he sadly died of a heart attack in the middle of this wonderful meal. And everyone's saying how it was so tragic. But on the other hand, I said, what if you had asked Andy Mack where he would want to die and when? It would be in the middle of a wonderful party in his own college. So there you go. So I have
Absolutely.
sort of a more positive view of death, maybe, having come close to it. So
you must have. You have this boundless energy. That's the thing that's always draws you. You have this wonderful love of life. And
absolutely.
Have you always had that? Have you always been this unstoppable force?
Yes, as a fetus, I have a picture of me actually in my mum. My mum was pregnant at the St. John's May Ball in 1962. And I can remember as a fetus then going, wow, this is where I want to go. So I knew as I came out, that's where I should be headed. So, yes, I think probably actually even pre-fertilization. Interestingly, my dad had exactly the same ideas and view of life as I did. My mum was really the diametric opposite. Interestingly, my mum and dad weren't married, so I lived just with my mum, and this man would come along every Saturday morning to spend an hour with me. I was a very clumsy kid, so my toys were often broken, and I'd hand them to this man and say, mend it. So he became Mendy. So Mendy was there every Saturday morning just for an hour, and until I was 11. When I said to my mum, I had always said to my mum, where's my dad? She always said, away. I thought that must be in another part of the world, and surely he'd come and see me. So when I was 11, I said, "You must have a picture of my dad." I was very slow. And she, at the next Sunday lunchtime, she produced a picture where I said, "This is a very young Mendy." And the Sunday after that, I said, "I reckon Mendy's my dad." "Oh," she said, "that took you a long time to work out." But then it was a nightmare. The senior consultant at Addenwood had to go and tell his wife, "Oh, you remember Phyllis who did the babysitting for us? Well, she did more than babysitting." But the thing, the interesting, going back to, so I only saw him for an hour for all those formative years of my life, and so my mum all the time. And yet I'm not at all my mum. I am completely my dad. How on earth did we get onto that? Boundless energy was actually, it's on the Y premise thing, because it was clearly my dad had boundless energy as well. So
obviously,
good on him.
Well, we're pleased he did.
Yes.
You always see like someone who has more ideas and thoughts than you can get into the average minute, or indeed the average second. And so you have to.
That's why I have to start writing them down. Otherwise, these days I've forgotten now. Oh yes, it was spleens and ideas, but otherwise I'd forget them if I didn't write them down. But that's maybe part of the problem of the head injury, is that actually for a long time I just couldn't remember. I mean, these days, if my darling wife has said, "Please, could you bring a pint of milk home?" And I forget. I used to say, "Oh, I have had an accident." Whereas I think it's just age now that they use such as like.
You'll never get old.
So when I was 40, do you remember Penny Watson?
Yes,
the queen of pancreatitis. So she was the year below me. She was at, where was she? So she was at Cats, I think, and she was the year below me. And when I was 40 at the vet school, she said, "David, you can't be 40. You were 40 when you came to the vet school." So there you go.
Yes. So I saw someone today that I was at college with, and she said to me, "I'm not sure whether it's because you're bald now or what it is, but you don't look any older than when you were at college." That was 30 years ago. She said, "Yes, and we all thought you were 15."
So interestingly, so some of my students were on nights a couple of weeks ago, and they were looking through some old photographs of the class photographs, and they showed me a class photograph of me in 1985. And Win Capital said, "David, you haven't changed at all." Because basically, I'm standing there like that, sort of with a bow tie on, and I still have that. But sadly, now that bow, I have 3 little hangers of bow ties, so I can be sure not to use the same bow tie again in however many weeks we said it was. But then I do have a little Genezer. The Jewish ceremonial burial plot sort of thing for bow ties that sadly are too frayed, I'm afraid, to be used anymore. So the one that this lovely student, Neve, found me in 1985 is now sadly in the little funeral plot of used bow ties. But there you go. So, but I would. The saddest is that first bow tie, that blue and white spotty, like a Robin. Well, I say Robin Day. People don't know. Do you remember?
I know Robin Day.
Yeah,
I know Robin
Grand
Day.
Inquisitor. Exactly. But somebody said, Winston Churchill. So exactly. So that that was the first bow tie one. And sadly, when it got beyond repair, I still feel guilty for throwing it away. That's the only one I've ever thrown away. All the others are still with me. So anyway,
not died but gone before.
Indeed, exactly. Yes.
I don't know. I don't know whether I want to cheer this up or not, but.
Oh, God.
David,
it's like the game is when our kids were younger, they had guinea pig after guinea pig, and they're still there now. I said to people, they're now subterranean guinea pigs. They go, "Really? I haven't come." There's a little cross above each of them in the corner of the garden. They say, they understand what I'm saying.
Fair enough. You said earlier on, David, that someone was looking down on you when you had your accident. And you alluded to the fact that there was a man in a flat looking down, and he phoned 999, which was very helpful. But do you think that somebody else was looking down on you at that point?
I mean, it is ridiculous, isn't it? If somebody else you could say, if somebody else was looking down on me, either he could have told the guy to slow down and go at 30 in a football, or make me look a bit closer and see the guy was going faster. So I mean, half of me thinks this is all complete lunacy. Although, so I knew I wanted to be a vet. So this is a bit of a tangent. I hope that's okay.
Yeah,
I
everything's
knew I
okay.
wanted to be a vet at the age of 6 when I took my guinea pig, Jean-Pierre, to Mr. Jordan in Cowan Street. And actually, I'll be going there tomorrow. Not Mr. Jordan, sadly, he's about 93 now, so he's not there on a regular basis. But so Jean-Pierre had this itchy, scratchy, scabby back, and Mr. Jordan took a little scrape from it, looked at it under the microscope, and showed me the mites crawling around. Gave me some white powder to put on. No suggestion of gloves. There was no cascade form, thank goodness, to sign. So and then I put that on Jean-Pierre twice a day. I didn't realize that later on, of course, as an organophosphate, it had been banned, but it killed the mites. Thankfully, really quickly before it killed Jean-Pierre or me. So, but I thought that was what I thought after coming out. Actually, Mr. Jordan concentrated on me, talked to me. My mum was in the background with the money, but he talked to me. I thought, that's what I want to be. I want to be a vet. Now, Mike, back to your question. So that was age 6. It wasn't. I was already going to church. My mum, of course, thinking that she couldn't give me any moral upbringing, given that the situation she had got herself into, took me along to church. I went to church, and when I was 10, I went to my first sort of youth holiday with the church, and there a guy said, there's God on one side and us on the other side. There's a big chasm between us, and then the cross, like, is a bridge across. All we have to do is walk across the bridge, and then you're with God. And of course, I could have said, good grief, where on earth is the atonement theology in that? But I didn't. So I said to my dorm leader, oh yes, fine. Well, I walked across the bridge quite happily, and so that was at 10. So 4 years before that, I wanted to be a vet. Then I knew from then that I became a Christian, as you might say, and so I've never looked back from then. You might say, how ridiculous to have the same ideas that you were born with when you were 10, but actually I think over the time you get to understand more and know more, and so you realize that actually it is, I mean, that thing about how on earth did God, if there is a God, allow that actually the sin, some people would say, that created me in the first place was my mum and dad getting together out of wedlock. How can that be? And then how could something like being knocked over by a car actually be part of God's plan? I think that goes back to the cross, actually. The cross, as who on earth would put their son up on a cross to die for humankind, but actually more than humankind, the whole world. But somehow that's faith, I think. When you can't understand, can't make it all obvious. You couldn't put it in a big textbook. I've got a fair few textbooks on theology, almost as many as I've got textbooks on veterinary medicine, but you can't put it into a textbook. But that's what faith is, I guess, isn't it? Is something that's in there.
Faith is a non-evidential thing, isn't it? It's a belief.
I mean, there can be like, you can have evidence. Like, I do believe that Jesus, I'm sorry, this isn't meant to be said, he's just said, was around and died, and then a whole load of people said he had raised from the dead and produced the church out. So all, you can have evidence like that, but actually that's all head knowledge, and something has to be heart wise to actually give you a reason for life in a way. That doesn't mean just faith, is it? So it's not just faith. That could be anything that actually what gets you up in the morning. And it might be the fact that yesterday, that poor dog that died, but actually you really gave the owner a reason for carrying on, because you were so kind and empathetic to her. That can be the reason that gets you up in the morning. But I think that's the sort of thing that's heart-wise rather than head-wise. How ridiculous that your heart is a pumping mechanism and your brain is the thinking mechanism, but somehow that's what we always say, isn't it?
But absolutely, it is absolutely.
Can I just carry on for a moment? So I was giving an after dinner speech a couple of days on Saturday to the Gloucester, Cambridge and Oxford Society. Who knows that existed? So and I was talking about interviews, and I started there. You can see where this is leading eventually, but I started talking about my own interview at St. John's when my director of studies, Reg Green, only asked me one question, and that was, would you like sweet, medium, or dry sherry? And I got the wrong answer. I really wanted sweet, but I knew that dry was the adult thing, so I said dry. And he poured himself out a huge glass of dry, me a huge glass of dry, slugged half of it down, banged the glass on the table. Tell us about yourself. And as you can see, I talked for about 20 minutes, and having only taken a tiny sip of the sherry, which I didn't like. And then the other interviewer, going to be my tutor, said, "Oh, that'll be all, thanks." And years later, when I became a fellow myself, I sat next to John Lee. I said, "Oh, John, I remember my interview." He said, "I remember your interview. We couldn't bloody shut you up." As you can see, Julie, the things never change, really. So then at this dinner, I said, actually, my son went for a new job recently. He's a computer coder. And after 2 hours of asking him all about his computer coding skills, they said, "Have you got a question for us?" And he said, "Yes. Where is joy? What place does joy play in your company?" Good one, eh?
Interesting.
So what part does joy play, guys, in your life? So I said it's very easy. Actually, just teaching in the best university in the world. Well, other universities are available. Walking through the cloisters and the courtyards of the best college in the university. Other colleges are available. Just sitting in the chapel and listening to the world's best choir. Other choirs are available. All of those just give me joy. Although there are issues that we've got at the moment. And one major one is this imposter syndrome. Do you remember imposter syndrome when we were at college?
Yes.
Yeah. I'm so superficial. I don't think I ever did.
There wasn't any. When we were at college, there wasn't any.
No, exactly. So these days, all these kids come thinking, "Oh, a terrible mistake has been made. I'm not really worthy of being here." And so our senior tutor on their first day tells all the freshers, you are amazing. You've got all your A-levels. You've passed the interview. You are worthy of being. You do deserve to be here. And I think that's completely the wrong way of doing things. I say to my little vets, the 4 or 5 vets I have with me, when I get them in a meeting, the first meeting they have with me, I say, tell me, when you opened the email, sadly, the email, he says, "Well, I remember when I found I had got a place, the guy, the telegraph boy knocked on the door and gave me a telegram that told me I had a place at Cambridge." But these days they open their emails and say, "What did you tell your parents or your friends?" She said, "I've earned a place at Cambridge. I've been considered worthy of joining this college community. No, I've been given a place." Everyone says that, doesn't they? What does that make the place?
Given a place, yes.
What does that make the place? It's a gift. And so actually at Christmas, if you gave your kids a present and they said, "Dad, I really don't deserve this," you've somehow got the idea of gifts wrong. I'm just giving you this gift. Do you know what really annoys me about Christmas? Is Santa Claus. Santa Claus says, "Oh, boys and girls, have you been good this year?" What I'd love is some little kid to go up to him and say, "Actually, no, Santa, I've not been particularly good at all this year, but there's 2 words that summarize Christmas, encapsulate Christmas. What are those? Not Merry Christmas, but unconditional love. Actually, I'm giving you a gift, not because you've been a good boy this year, but actually, and not because your parents have paid £8.50 for me to give you a present, but actually, just because I love you." So anyway, how did I get onto that?
Yeah, but
you get into joy.
Yeah, you'd get into trouble bouncing a kid on your lap as Santa Claus going, "No, exactly. I'm not going to give you a gift. It's because I love you." You'd be marched out of there straight away.
Well, yes, these days.
So interestingly, so what I said to this group that I was having a drafted in a speech was, I said, so the trouble is, the question is, at an interview, can I tell who actually is going to be the right person, the person who will most enjoy 6 years at Cambridge? Yeah. And people will say, "Oh, you need to be objective." Bristol, of course, these days don't do interviews. They just do it all on the results, the results of the questionnaire or something like that. And but I think the key thing, I'd be interested to see what you think about this. So I said to them, "I'm going to make you the interview panel today, and I'm going to tell you 3 vets that I interview that actually are old vets now, but to see which you prefer." So vet number 1, the first question I always ask in an interview is one to relax the student. So many interviewers seem to want to do the opposite to student, but I want to relax the student. And I say to them, have you got a case, an animal that you've seen while you've been doing work experience that actually you could, they excited you, interested you, challenged you, that you could tell us about? And so here's student number one who comes in and he says, oh, this dog was knocked over and broke its leg, and they took an X-ray and they opened the muscle. They give it an anesthetic. They open the muscles. They put a plate in with screws to screw it in place, and they sorted it. Okay, that's number one. Number two says, oh, we had this dog that I was knocked over by a car, and they X-rayed it, had a mid-shaft femoral fracture. And so they, interestingly, I was interested to see, as they did the operation, they parted the muscles so they didn't cut through them, so there was better healing and less blood to obscure the side. And then they put this plate on, but interesting, the plate had oval screw holes. So as they screwed it in, it joined the bones together. And actually, apparently there's these things called Haversian canals that if they're joined together well enough, heal the bone much quicker. Oh, we like that, don't we? Well, at Cambridge, we like someone who's a bit scientific like that. So then third candidate, it's a lovely young lady, and I'm probably not allowed to say that these days. But anyway, and she said, well, this dog came in with a fractured leg, and it was fractured in so many places that after they'd done the X-ray, they put a number of different pins through the skin and the muscle into the bone and out the other side, and then they created this metal sort of scaffold around it. That was interesting, but what was really interesting was what the vet did beforehand. He knelt down to the two children that were there, and she said, I do remember this so well. And I hope if you're out there, listen, you can remember saying this, whoever you are, because I can't remember your name, but she said, actually, the children were more broken than the dog's leg was. Wow. Now that's somebody who's really seeing what's going on. And then she said, the vet said, I'm going to mend your little bonzo's leg, and I'm going to put this weird contraption around it. Don't worry, it looks horrible, but it'll mend it all together. But I can do that today. What you've got to do over the next weeks is love Bonzo and care for him and not be put off by this horrible thing around his leg, and love him. Now, I said to the assembled multitude at dinner, forget who you would bring in as a vet student, who would you want to take your dog to in maybe 8 years' time to care for him? It's a no-brainer, isn't it? We interviewed 36 candidates for 4 places last week. And actually, tomorrow we have our decision meeting where the 2 physiologists who interviewed them for science, and myself and the lovely Lucy, who actually I interviewed to come in 2002. So the 2 of us had rather different questions to ask than the scientists, but hopefully together we'll work out who's going to be best to be a wonderful vet and also to be able to survive the 6 years at Cambridge.
And the stresses afterwards.
And it is the stresses afterwards, yeah, exactly. Although I have a feeling, actually, one thing that Cambridge does better than any other vet school, I think, Cambridge, I'm saying this, is to make people resilient, because the stresses you come under at Cambridge when you're taught by Nobel Prize winners, and then they expect you to remember what they taught you. Those are far more than any normal vet school that actually teaches you in a clinically relevant setting.
I think you're right.
Apologies to everyone from Cambridge for saying that. But what I do is I make sure. So every week, do you remember something that might sit in the old days, used to sit on your back seat of your car, still in its plastic wrapping, the veterinary record?
Yes, it is now in a paper wrap. Still sinks on the back seat.
I rip those open every week and I give them to the students, and then I get them to review one of the articles from there. So the seropositivity of wild dogs in Tanzania to rabies, or something really relevant that
absolutely cutting edge. Yeah,
exactly. So I mean, so nothing wrong with some great stuff. So, and then every week, through those years when actually all they're going to get in the lectures is hardcore science, I then bring veterinary medicine into them. So hopefully I keep them going as vets, even for the hardness of basic science that we teach them in the first 2 years.
And I think you're right. We've got to bring the humanity in. So, someone said to me a while back, and we brought this up several times on Veterinary Ramblings. So someone said, "Do you?" I heard this. I heard that humans can be treated by vets in an emergency. I said, "Well, vets always treat humans. I don't treat a dog on its own. I've never treated a dog on its own. We treat dogs and their owners. We treat that, that bond. We treat the parcel." They said, "Well, it's not really, you're not really treating that." I said, "Well, have a chat to anyone whose pet has been unwell. They are unwell. They're viscerally unwell until their pet is better. And that's what we're treating. That's what we aim to treat."
Absolutely,
and you mentioned,
for sure.
And you mentioned joy a moment ago as a throwaway. It wasn't a throwaway statement.
I mean, it's the center of everything, really, isn't it? I think if you can't wake up in the morning and feel in some way things may be awful, but so ironically, my son who said that and got a really good answer from the senior people in this company, actually now, having worked there for a month, he realizes that actually the people he was working with actually weren't full of joy. And so actually, ironically, he's left and now he's looking for something else. But interestingly, and he was pretty down then. And I said, "Look, well, you need to remember what you said about joy. You need to find joy in being able now that you're not working to go out and walk in the park in a beautiful sunny morning. That sort of thing needs to, and your girlfriend, all those things need to give you some joy that otherwise, so many people go through life without joy. I think it's so sad.
And a lot more have joy that they don't realise. So what's joy? You asked what joy is. What joy do we have? Look, I'm on Veterinary Ramblings with my best friend Mike. The joy we have, and I'm going to read a quote here from my favourite author, Khalil Gibran, from The Prophet. "And let your best be for your friend. If he must know the ebb of your tide, let him know its flood also. For what is your friend that you should seek him with hours to kill? Seek him always with hours to live. For it is his to fill your need, but not your emptiness. And in the sweetness of friendship, let there be laughter and sharing of pleasures." This is my favourite bit. "For in the dew of little things, the heart finds its morning and is refreshed." And that to me is the joy of friendship, the joy of having you on Veterinary Ramblings, joining our little friendship group here.
I love that. The dew of little things. That's
fantastic. Isn't it fantastic? Just a wonderful throwaway statement. But yeah, joy, people don't recognise it, I think. In this day and age, joy has to be.
I'm just going to write that down because by the end of today, I'll have forgotten that. The dew.
Or in the dew of little things.
Of little things. Perfect.
The heart finds its morning and is refreshed.
That's in
morning
the Prophet.
with it. Oh yeah, that's great. Lovely. Sorry,
that's in the Prophet, David.
Yes, indeed.
Yeah.
Glorious.
So yeah, I think people want instant gratification these days. They want to have some sort of endorphin release,
indeed.
which they'll get from TikTok or one of these things. But actually, nothing beats sitting down with a friend and having a laugh, having a chat.
Yeah, sure, absolutely.
Earlier on, David, you mentioned imposter syndrome.
Yes.
Do you feel that the younger generations are suffering from imposter syndrome, or is it a function of age and experience?
No, I do. I think. I do think it's the younger generations that. Oh no! Having said that, so just before this meal in Gloucester, I stayed with a friend who was from Lucy Cavendish, who came in and certainly in 1982 felt imposter syndrome. I still think now she feels that, and I don't know. I mean, I say, Becky, you're amazing and fantastic, and you should never feel so. And the years of experience she's got, I think she still feels unworthy. So actually, I think is really sad. But I think certainly youngsters these days often can feel that. So I mean, maybe it is because there's so many things coming at them through social media and things like that. I don't know whether that's a key thing.
It's an interesting view because we hear a lot of the young folks today very often are shouting their own prowess very loudly and have a lot of self-confidence and self-belief that is not necessarily best placed, and
But-
that we reserve imposter syndrome for older, let's just say older people, where the more we know, we realize there's more that we don't know.
Oh, for sure, absolutely. But I think with that comes an acceptance, rather that in that case, like everyone is an imposter. So as long as you know that's the situation, I think yes, I'm not sure. I mean, I can see you might think that, but I think so. So you say so many of these kids are shouting out that they're amazing, but actually, once you start talking to them like we're talking, actually you find that that shell is actually hiding a deep insecurity inside. So and I don't know why. I can't tell where that comes from. Yeah.
No,
I mean,
there's
I've got-
sometimes a sort of false, humble imposter syndrome, isn't there? We can say, oh, I have imposter syndrome, where we actually feel that we are experts in this field, but we want to appear humble.
Right.
Or we can actually feel completely out of our depth and think, can I do this? Am I right for this? Am I educated enough? Am I clever enough? Am I the right person to do this? And that's the true imposter syndrome, which I think is always worth putting yourself through, is worth asking yourself, do I know this? Because that gives you the spur to be the person to do it, to learn properly, to make sure you have the facts.
Well, so for me, the spur to learn more is just a love of learning. So, for instance, I just finished my doctorate in education. I spent 5 years. Well, generally, my wife will say 6, maybe 7. I don't know how. An awful long time. And looking at how, my initial question was, how can we teach ethics to vet students? And actually, so it took me a long time to do that. But the reason for doing that was love of learning. I'm just looking at whether to do a master's in ministry and theology with the University of Durham. Again, just because I love,
the sheer love of learning.
And I say to the students on their first day, if you can love learning, then all the time in the library will not be saying, oh shit, there's another well, I've got to do. But actually, just to be so enjoying it that you just keep on carrying. And the exam is like a side issue in a way of just the enjoyment of, because if at Cambridge said the sort of stuff you have to learn in, say, physiology in a first year, if you're saying, oh, what of this is going to be relevant? Is anyone going to come in and say, oh, vet, I really feel that my dog's voltage-gated sodium channels aren't particularly working well today? Nobody's ever going to say, so why the hell should you ever need to know about voltage-gated sodium channels? Or what happens if you integrate an area under the curve and find the total distribution volume of some pharmaceutical.
I'm going to have to stop you there, because a couple of weeks back we had someone on VR who said, whoever remembers Krebs cycle after studying it, and Mike and I both then recited it because we love it, and we didn't.
Absolutely.
But we love it because you can apply it. You can apply it to different metabolisms, with different reasons for eating and training and things. And the voltage-gated circuits, it's my thing on occasions, and it's the love of learning again, isn't it?
Exactly. That's right.
Yeah.
Yes.
But anyway, sorry. What Cambridge, the teaching of irrelevances you were talking about.
Yes, I mean, it's true. What I love about Cambridge is that you'll sit down. Again, we do lots through eating and drinking, and so I'll sit down at a table and find someone who's I may be sitting next to the Regis Professor of Medieval Hebrew, or I might be sitting next to an astrophysicist, and the glory of just being able to chat with them, the potential collaborations that can, but even without any defined aim, we're just chatting and drinking and eating. And it's just glorious. Every day, I'll just go and have amazing conversations with people and just fun evenings. So,
It's
yeah.
brilliant. I remember about 30 years ago, no, it must be 35 or so years ago now.
What's
I was having a
COVID?
drink with
40
someone
years ago.
from 40 years ago. So we drink with someone from the Egyptology department at Nottingham University. And that led to a collaboration. So I was working on virology then. Led to a collaboration looking for smallpox virus in mummies.
In mummies. Yes, fantastic, lovely. That was the days before PCR, I suppose, wasn't it?
Well, no, PCR had just been invented.
Right.
Yeah.
Brilliant. So for sure, amazing. Yes. That's a bit tricky though. If you're suggesting, oh yes, fine, the ethics, the health and safety, and thankfully in those days you probably didn't have to fill in a whole load of health and safety goals. If you had to, you'd never have done it. When you said, "Oh, well, we're looking for smallpox here, and let's get smallpox."
Well, firstly, it hadn't been eradicated. Secondly, we're only a bit of subunits who are part of the capsid protein.
I remember I'm doing pathology in my third year at Cambridge, and Professor Wildy was the professor there, and he had been the professor in Birmingham, where someone had turned the fan on the wrong way and put rather than intake, put exhale on the fan and had blown smallpox virus onto the street. And you laugh, but actually 2 people did die. But amazing to be able to find that there was that one street they had walked up and down, and it was. Then he fell on his sword and said, "Oh, it's not my fault, but even so, I'm in charge, so I'll leave." Because I think he knew there was a chair in Cambridge that was just waiting for him. So
fantastic. and now we've not spoken at all about eyes, David, but that's what most people associate you with now.
Yeah, indeed, absolutely. Yes. So you want to know why? Yes. Shall I tell you a little story about how? So EMS. I mean, seeing practice. I'm so much better at quality of seeing. So it was wonderful because you had to go somewhere where you knew some friends who could put you up. And through actually a church in Solihull, I knew some friends there, and so I just went along to their vets. And John Heath there was the senior partner and was an absolutely wonderful guy. And so I went along there, and he was passionate about ophthalmology. In the days when very few people in practice had got a certificate, an RCDS certificate in the subject, he had that. And so it was wonderful. And he was things like, here's an example. So he was also the secretary of Warwickshire County Cricket Association. He brought Brian Lara to Warwick. Okay, but amazing. So, and he said, "Oh, David, I've got to go and sit in a committee tomorrow. And here's a dead dog, and here's a Bissler's Book of Veterinary Ophthalmic Surgery. Have a go, and here's my wonderful nurse Jane. Have a go at doing a parotid duct transposition on this dog, where you move the parotid duct from there up into the eye, and it took me all day. Eventually came back and showed me some extra little tips. The next day, he said, "Oh, David," he said, "I've got to sit and write up all these committee meeting notes. I've got another dog that now a live one to do a parotid duct transposition on. I haven't done a parotid duct transposition for 3 or 4 months, but you did one yesterday, so you do it." So he was in the same airspace, and so it was there when I said, "Oh, John, what do I do?" Well, Miss Heath, what do I do in this situation? And most of the time, Jane could tell me what to do, but so occasionally he came over and told me. And so that was before I'd done a bitch spray, I had done a parotid duct transposition, so I knew that was the way to go. So anyway, forward on a bit. So my last summer, I had already done my 26 weeks. Oh, I'm so angry at the Royal College for reducing the number of EMS weeks. That EMS is where we learn, isn't it? Anyway, so I'd done my 26 weeks. So the last summer I could spend working with a wonderful missionary vet in Alison Craven in Nepal. And 3 weeks before I was due to fly out, the Nepalese government said, "No, we're not having any more foreigners here. In fact, we're checking all for. Oh no, we'll keep you, Alison, because you're running all our agriculture service and the NHS, the Nepalese health service." So they kept her, but they wouldn't let me in. What am I going to do for the whole summer? So I rang Dr. Barnett at the Animal Health Trust, and I said, "Oh, Dr. Barnett, I'm so interested in ophthalmology, and I've loved your lectures." Oh, his lectures were only chalk and talk. draw a circle with a squiggle in the middle. There was no way of knowing whether it was a corneal ulcer or a cataract or a retinal detachment. But he turned everybody off the subject apart from me. And I said, I love your lectures. Can I come and work with you? Oh, Rui said, no, we only take graduates. We don't take undergraduates. And but I said, oh, John Heath from Solihull recommended me to come and work with you. Oh, he said, oh, you knew John Heath. Oh, he said, well, how long do you want to come? I said, the summer, please. He said, well, come on Monday and we'll see how we get on. So I went on the first Monday of my holidays. And the first thing I saw was a dog with a hazy looking lens. And he handed me a direct ophthalmologist who said, what's the dog got? I said, oh, it's got a cataract. And I remember him putting his hand to his head and go, this is in front of the client, and go to the owner and saying, I spent an hour explaining to you the difference between nuclear sclerosis and cataract. And he showed me that you could see through with the direct ophthalmologist a lovely reflection from the back of the eye. I knew then that it was nuclear sclerosis, not cataract. So, and through the rest of the day, I said, oh, that's uveitis. No, it's glaucoma all the way through until the last case of the day, which was a hazy lens. I said, oh, this is nuclear sclerosis. And he said, oh, quick on the uptake, aren't we? And he said, how long do you want to stay here? I said, the summer. I said, by all means, stay the whole summer. And I had a wonderful time, saw hundreds of eyes. So one of the reasons for doing my Instagram bow tie is that then every day you see a new case. So today's, for instance, is a lovely rag doll with a wonderful shimmering nystagmus, and of course, yesterday was a bow tie. The day before was a dog. I saw, as I say, someone emailed me saying, oh, please, we've got this dog with glaucoma, I think it's glaucoma. I haven't got the tonometer, but it's got a dilated pupil and a red eye and blindness. And I said, oh, yeah, sounds like glaucoma. And have you got any drugs or no drugs? So I said, get the owner to do a script for latanoprost, get them to bring it back with the dog, put a drop in the eye and see if the pupil constricts. And if it constricts, you don't need to measure the pressure. You know the pressure's gone down. I said, oh, how can I repay you? He said, all you have to do is give me a photo before and after you put the drops in, and then let me put it up on the Instagram. So he did that. So every day I'm excited by a new case that's come along to put on it. And that's because for that summer, I learned so much from Heath. So at the end of the summer, he says, go and work for John Heath for 2 years. You need to get general practice experience and then come back and be my assistant. No interns or residents, just an assistant. So that's fine. So then with 3 weeks to go before finals, do you remember revising? When you would read through something and you knew it. So it was pointless having read through it because you knew it. Or you find you didn't know, you thought you knew it and you didn't know it. So then how much more have I got to go before with that I might not know? So I said, oh, Keith, I now knew Miss Keith. Keith, can I come and just work with you just the Monday? And actually, I spent the whole week with him. And he said, Beverly, my assistant, has actually got a research position next year. So I'm looking for a new assistant. And I said, oh, but you told me to have 2 years in general practice. So I said, this will never come again. Just come like this. So I went along for the interview dressed as I am now. I think a slightly more degree bow tie, but not much. Maybe my blue and white spotty bow tie. Anyway, so
Robin Day.
And I have an interview with Andrew Higgins, the head of the Animal Health Trust, and Keith. And the only other person who had come was a wonderful guy. You may remember him, Pip Boydell. And Pip,
my both
like
you
this.
and Will.
Pip came all dressed in black with a shock of black hair and pink winkle picker shoes. And so he was amazing. And he had already he was a qualified vet for several years. He'd worked with Tom Yarrow in London. He knew everything. And yet I got here because of the bow tie and not having pink winkle picker shoes. So that was how I started in ophthalmology then, really. And it was an amazing 2.5 years of being Keith's assistant. And the great thing was that you think, how did I learn anything other than ophthalmology? Well, next door to the Animal Health Trust was Spillers, the pet food company. They there had 50 dogs and 350 cats, and they're just for palatability studies. And they wanted them from puppyhood to senility. And so I was just thinking, gosh, that sounds a bit like me, doesn't it? But puppyhood, the senility. But so the lovely thing was that right from animals that are needed cesarean section through to animals that were needing tumor removals or euthanasia, I saw all of that. And instead of having those annoying things, what are they called? Owners. Instead of them, I had 3 lovely ladies who looked after all these animals and looked after me as well. So it was a glorious time of learning ophthalmology, but also learning everything you need to know. And of course, I think if it was a difficult surgery to do, I'd just get one of Nick McGlennon, who was a lovely surgeon there, would come across and help me. Or if there was a tumor, Larry Owen would come over and help me with the tumor. It was just glorious to have that way of learning the rest of veterinary medicine and being immersed in ophthalmology in a way that you could never eat these days. The interns and residents, there's no way they would see 10 cases a day. It was just unbelievable. And just Heath and me and the animal and the owner, it was just a glory. So
The halcyon days.
Absolutely, for sure. I mean, what I love these days is having I've got 3 lovely students with me at the moment. And so we bombed around in the car today. We went to a lovely practice where we saw a dog with progressive retinal atrophy, perfect to show them the lovely case with really bright, shiny, reflective tapetum, and a dog that was nervous going out at night. So lovely to be able to show them that. And then pop to another practice where there was a dog with a corneal ulcer that needed a diamond burr. And then, I can't even remember the last case. So all of that sort of thing to do. And it's lovely. I love having students with me because it's great. I can see yet another corneal ulcer. But if it's the first case they've ever seen having a diamond burr, that's what keeps me going.
Absolutely.
It worries me that when I talk to them, so many people who see students with EMS put them in the corner of the room to observe, and that can't do them any good. It can't do the vet any good either, can it? So
no.
If you're seeing a case with a vet student with EMS at the moment, make sure you involve them as much as John Heath involved me. So.
Absolutely, they're all part of it. I remember when I had my own practice and could direct length of consults, then when I had a student, consults would always double in length.
Yeah.
And we'd have the owners would be on board with it. We'd have a huge discussion. The owners would take part. We talk these days about contextualized care. That was contextualized care.
Sure. So John Heath always used to say, if you can't come up with the diagnosis in a few seconds, there's something wrong with you for the vast majority of cases. But the owners are paying for more. So you have to interact with them, talk to them about cricket or their holiday or whatever. They don't really want you to talk. You've told them what's wrong with the animal. And maybe they don't want to talk about the animal anymore, but just talk about something for another 10 minutes. And then everyone goes very happy. So
yes. I couldn't agree more.
I'm going to refer you to a proper cricket expert. Because I'm not sure about this new rule about leg before wicket. So I'm going to refer you to the referral hospital because they're really good at cricket. Yes.
That's what it'll be these days, won't it? They want conversations. It's all referral.
Yeah.
In the old days, and there are some practices that still have it, the vets would have a go. And if you've got an owner that isn't insured and they can't be referred, are you going to have so many new graduates say, actually, maybe euthanasia, have a go. And if for the end of the say to the owner, look, I'm going to this corneal ulcer, David Williams says you can do this thing called a Hood graft. That's really easy to do. If you've got a corneal ulcer, just cut round the top 180 degrees, undermine, pull the conjunctiva over, stitch it with 4-0 Vicryl. You don't even need magnification unless you've got eyes like mine. But stitch it 4 or 5 times, 4 or 5 individual stitches with 4 or 5 with 4-0 Vicryl. It stays there. It oozes serum continually, and then it lifts off. And I say, you don't need to refer any corneal ulcers, please. A melting ulcer, it works perfectly. It's fantastic to do. But so many of the new vets will say, I'm not sure. It would be better to refer. No, it'd be better for you. That's something they won't do it over referral. You can't charge them £3,500 for doing that because you could do it on your kitchen table, basically. So
absolutely, vets at the moment are still able to do everything.
Absolutely.
And we're going to lose it. We're going to lose it if we don't keep up with it. When I first qualified, after my first year in practice, I'd done more hemilaminectomies and thyroidectomies than I had cat spays. And I was so lucky in that practice.
I'm surprised. I'm sad that you were so afraid to do cancer. No,
I still am afraid.
But I did have a go.
I was going to say, could I ask you? You mentioned ulcers. You mentioned diamond
Yes.
burrs. I wonder if there's any way that you could talk to us about ulcers for just a minute. Just
a minute. Okay.
You are very enthusiastic about this,
Retain
as
your
you are
enthusiasm.
with everything, David, which is why we love you. So what we're going to do is we're going to do what we call a special section on Veterinary Ramblings, which is called 60-second CPD. It's even got a title, you see, David.
Yeah, flip. Amazing.
We call it 60-second CPD. So what, Julian, you're teeing David up here to talk about ulcers. So we're going to talk about ulcers for 60 seconds.
Is that right?
Is that what we're going to talk about?
Good. Sounds good to me.
Good.
Like,
This is something I see every day.
Not
Yes,
gastric ulcers, not
No,
ulcers.
No.
I know nothing. Well, I can tell you about gastric ulcers in horses and their welfare, if you like, but probably that's not what we're going to do, is it? No.
No, that's not what we're going to do. Right. So I'm going to put the timer up on the screen here then.
You'll flip.
So
Right.
60-second CPD from Dr. David Williams, all about eye ulcers, starting now.
And hi, when you see a corneal ulcer, what do you do? What I would like to suggest there are 3 questions that you should ask. First of all, what's caused it? Maybe an exogenous trauma or an infection, or is it something going on in the eye that's the root of it? Maybe dry eye. You should be doing a Schirmer tear test in every ulcer, to my idea, or an inbuilt failure of the adhesion between the epithelium and the basement membrane, what we used to call a box ulcer that needs a debridement. Secondly, how deep is the ulcer? Is it superficial, like one of those boxer ulcers, or is it deeper? Is it actually in the stroma? Maybe nearly all the way through, with the descemet membrane bulging out in front, and that's going to need some special hood graft. But the next thing is, the last thing, is it healing? Is a superficial ulcer healing really quickly, or in a deeper ulcer, are there blood vessels coming in towards it? So all of those things we need to say to know what to do with the ulcer.
Fantastic.
There we
I think
go.
that's within the limits of standard deviation. You got it. 60 seconds.
Fantastic. I think it was good.
Thank you so much.
So the next thing was that we need an hour to talk about what to do having got those questions answered, but that's for another time, I guess.
I think that's for the time you come back and see us again.
I think so too. That's definitely the case. So
I think that deserves a certificate.
I was going to say, have you got a certificate?
Well, I have, but we need the reflection first. And not reflection from the tapetum lucidum, but David, you know that to register CPD, you need to reflect on it these days.
Indeed.
And
Yeah, so we need a reflection question, really, don't we?
Flip, I did write that down, didn't I? And I've completely forgotten that you had said that. So let me think of a quick. So a reflection on. I'm going to ask.
No.
How about something about pain?
Oh, there was that. So is this eye? Was it something like, is this eye in painful? My concern is that so many people have dogs that don't really seem in pain. I've got dogs with glaucoma with really high pressures that don't seem to be in pain. And lots of people say, oh, that eye needs to be enucleated. And so the reflecting question is, well, how do we know if an eye is in pain? Does that sound reasonable?
Yeah, that sounds reasonable. Yeah.
Sorry to have completely
I
forgotten
poke it.
what I was going to say to start with. So,
I look prod it.
and see, if
Yeah.
it squirts back at you, you know now it's in pain. Maybe that's
Yes.
not the right answer.
Well, I think
Hang on. So
If-
I've got a question here,
Yeah.
which is probably going to extend our whole thing and won't let you bring the certificate out for a long time.
okay.
But David's asked us there about pain, and obviously a lot of our guests are very keen on controlling pain, as we all are in this room, controlling pain. But Descartes would have us believe that animals don't feel pain.
Descartes did say that, indeed.
So he didn't realize that he was an animal and he certainly felt pain. And of course, then the question is, I mean, right down to invertebrates, the pain, of course, is a noxious stimulus, a response to noxious stimulus, and also an emotional response to it. So that, I think, would be where he would say certainly the animal responds to a noxious stimulus, but he would say the pain is the emotional side. Do you remember Victoria Braithwaite's book, Do Fish Feel Pain?
Yes.
Yeah.
I know what she wanted it to do was be a very one-page book where you just open it and it said yes.
Yes.
So she did and the stuff that she did, interestingly, with Lynn Stebbins.
She hinted at it towards the end, didn't she?
So what she did was it's a bit difficult because she had to call some pain to show it. So they gave a fish painful injections around its lips, and then they put a novel object into the tank, and the fish that were normal investigated the novel object, and the fish that were in pain, as you might say, didn't. And then when you gave them an anti-inflammatory that actually, or an analgesic that stopped the pain, they went back to investigating the object. So from that perspective, you could show that there was a behavioral change in that fish while it was feeling something that we would feel as pain. And of course, it's got all the nerves and the substance P's and all that sort of transmitter molecules. So, but also it's got the behavior that suggests. So I'd say to Descartes, actually, Descartes had a dog. I remember what his name is. But actually, I'd say to Descartes, if you know that your dog that you love, I bet he did love it, actually, that dog, if you hit it, it would yelp, and actually it would sleek away, and they wouldn't want to come back to you the next time it came to you. So in that way, Descartes, you should have realized that actually what you were seeing was pain. The thing with Descartes, of course, is that when he was 12, a guy came to his school and said, oh, there's this guy called Galileo, and he's shown that the moons of Jupiter are actually circling around the moons of Jupiter. So not everything is circling around the Earth. So the fact that the sun comes up in the morning and goes down in the evening, what you're seeing isn't actually reality. Reality is something, your view of reality is only your view. It isn't. So which is why Descartes said, if I can't understand anything out there, because it might be me, the only thing that I can do to know that I'm me is think. So that's where cogito ergo sum. I think, therefore I am.
Therefore I am.
And I love that. Back to 12 years old. And so he would say, the fact that the dog looks as though it's in pain, if my thinking, my little theory is that dogs don't feel pain, then there has to be another explanation about it. Of course, that's completely the wrong way around of thinking it. And
it was a rather teleological explanation, wasn't it?
Yeah,
that led him to nail dogs to boards and do awful things like that.
Indeed, exactly. So, yes, not good.
So I guess the question there is, and I don't want to go too far down.
Go the further down the rabbit hole, you might find a rabbit at the end of it.
Shall I do that?
Sorry, carry on.
Okay, so here's the question: do dogs have souls?
I'm not sure. The question is, do we have souls? So I mean, I know my shoes have got souls, but maybe that's different. But so souls, of course, are a Greek classical theory. So if you look at the Bible, actually look at the Old Testament, there's the spirit, the ruach of life that's there in animals and in man, in say Genesis. And so actually saying that there's a big difference between animals and people in having some everlasting being sort of thing, actually probably I think comes down to the Enlightenment that said, animals don't really think. Well, back to Descartes, they don't think, they don't feel, so they don't have so they don't have a soul, so they actually, so if you go back further, go back to Pythagoras, and Pythagoras was vegan because he thought that animals were reincarnated people, but he even thought that beans were reincarnated people. So he didn't like eating beans. And if you're a vegan without beans, I'm surprised he didn't wither away. Anyway,
It's a tricky old life, isn't it? Yeah.
how the hell did I get onto that? So souls are really a sort of a Greek theory, and really the Old Testament and the New Testament didn't think of there being a different bit of us that wasn't like us. So didn't have that the soul body paradox that came along later. And it was because people like Thomas Aquinas were really taking stuff quite as much from the Greeks as they were from the Bible, that they came up with this idea of souls that people have and animals don't. So I'm not sure. Now, you might say, does a slug have a soul? Well, but then on the other hand, so if you saw an earthworm in the middle of a dry path, would you just stamp on it, or would you leave it, or would you actually pick it up and put it in the undergrowth by the side of the road? Well, it's an earthworm, so. But actually, even so, I think it's part of God's amazing creation. Do you know, Al, one of my key heroes is Albert Schweitzer. Do you know Albert Schweitzer? So
Yes.
Albert Schweitzer was a professor of philosophy
early Nobel
and
Prize
theology.
winner.
Right? Indeed, professor of theology and philosophy. And then he thought that God was saying to him, actually, no, I want you to go and do something useful with your life and be a medic. And so he went back to medical school, and then he managed to find someone who would give him money to go and start a hospital in the Belgian Congo. And so there's some lovely pictures of him with his favorite pelican, and any animal that came into the hospital ill, he would treat quite as much as he treated the people. And then you're going to say, well, how far down the line does an animal then go before you make it a pathogen? And of course, you had sleeping sickness in those days. And then the Germans had come up with their chemicals, and so realized that some of these chemicals could actually kill the protozoa.
Trypanosome.
Trypanosome, yeah, the trypanosome that causes sleeping sickness. And then he felt bad because his idea of reverence for all life. He felt bad when he could see down the microscope the trypanosome gradually dying when he put the medicine in. So he felt that there was a reverence for all life, but that there had to be that actually, if there were people or animals that then were being killed by protozoa, then it was reasonable to kill the protozoa. But he even then he had a real difficulty about what to do in that situation. So it's silly to go, oh well, he's the answer to this. So
it occurs to me we've gone full circle on this, because you mentioned vegans and not eating beans, and that led me to think, well, lentil bakes out, and then lentils, of course. Well, our lens was named because of lentils. Lens is a lentil shape. So we're back to ophthalmology, which means I can give you the certificate now.
Oh, glorious.
So now here we go. This is a certificate.
Oh, wonderful. Thank you so much.
Pretty damned amazing with eyes. Because
glorious.
And so we've got my favorite. I'm going to start with my favorite photo of all. This is a reflection of me in my daughter's eye.
So the lovely. Can I just quickly stop you there for a moment? So what I say to the students is, why do we call it a pupil? So you were pupils when you were small children in school. The pupil, of course, in Greek is just small person, and people thought that they were looking in and seeing a person, and when they waved at the person, it waved back. So yes, that's lovely. So fantastic. Well done.
Absolutely, that's it. And of course, you know what that is.
Yeah, glorious.
So a rhinoceros.
And rhinoceros, good. Lovely.
Now there's Medusa, who had
glorious
snakes, of course, with eyes.
How many spectacles? What a spectacle that is!
What a spectacle indeed. Now, there's
a lizard eye.
A slow eye. A lizard eye. Absolutely.
Yeah. So a lizard. I was right on the lizard bit. Yeah.
You were right on the lizard bit.
Interesting. Can I just say for one moment? So when my kids watched the first Harry Potter film, they were outraged. The snake blinked eye, and they wrote to J.K. Rowling, who said, "Excuse me, go back and read the book, the snake doesn't blink in the book, and it was the filmmakers that wanted the snake to blink. And I said, no, but I lost the sort of statement. So don't blame me. So there you go. So yeah, go ahead.
I know, it's awful, isn't it? And now this is a cat
Oh.
with a little hemangioma on the medial.
Poor little thing.
But no, this was great because it was a lip to lid reconstruction I did. Here we go.
Oh, love it.
And,
Very excellent. It looks fantastic.
and the lip to lid was one of the first, Lessex transposition flaps. And it was one of the first
Indeed.
flaps I learned about. It was from your lecture when you told us about
glorious.
rebuilding the eyelid.
As there's just a mucocutaneous junction
Yes.
just waiting to be used there, isn't there?
Yeah, absolutely.
Good
So
stuff.
there we go. That's good. Thank you
Thank
very
you
much.
so much. That's brilliant. Wonderful.
So during our conversation, Mike and I have been using the private chat function to sort of steer things on.
I'm not sure I want to know about your private chats.
Well-
Excuse me.
So Mike has just asked me whether we should ask the difficult question, and I wonder,
Yeah, go for it. Whatever it is.
shall we do that?
Yeah. Have you got the balls to do it?
So, David, you've always steered away from asking this question. It's funny, we've got to know each other pretty well over the course of tonight's talk, but I think I'd be brave enough to ask the question
Go on then.
next time. If Mike can
Oh.
ask it tonight, then I'll ask it next time.
Okay.
It's just-
All right. Well, fair
It's a
enough. I
thing
think we've talked about theology. We've talked about surgery. We've talked about ophthalmology. We've talked about lots of things. But a lot of our listeners really want to know, David Williams, what is your favourite bread?
My favourite bread, well, to tell you the truth, this is very boring. So actually, it's the bread that my wife makes. So, which is just glorious. So I can't even tell you quite what's in it. It just comes out once a week, and it's glorious. So that's my favourite. And although interestingly, I was in Gloucester a couple of days ago, and I was staying with some lovely friends, and so there was a glorious bakery there. I just bought a fantastic granary sourdough, and that was glorious. So I enjoyed that. But yeah, my wife's is the loaf I really love.
Fantastic. And my family always say the bread I make is their favourite.
How diplomatic is that?
Wonderful. David, what an amazing guest. Thank you so much.
No, it's great fun. I so enjoyed it. Brilliant.
Well, I was going to say, I think that probably brings us towards the close and leaves for us to say, Dr. David Williams, thank you so much. And to our listeners and viewers, check out David's Instagram. It's called bow_tie, tie spelt T-E-Y-E. I think I've got that right, have I, David?
Yeah, sure, exactly.
Yeah.
Yes, absolutely.
And he'll keep you up to date with any of your ophthalmology revision and challenge you on quite a few things. So all it beholds for me to say is, Dr. David Williams, thank you very much indeed. To our listeners and viewers, if you've enjoyed what you've seen and heard tonight, don't forget to drop us a line, and please like and please subscribe, because it really does make a difference. So from Julian and I at Veterinary Ramblings, Dr. David Williams, may your dog go with you.
Thanks so much.
May your dog go with you.
Bye.
Cheers.
Cheers.